Hi, it's Jessica DeMassa with WTF Health. With me right now, I have Ken Cahill. He is the CEO of SilverCloud Health. So Ken, it's great to have you with us.
Thank you for the opportunity.
All right, so you are a digital therapeutics company, but introduce everybody to what you guys do. You're in the mental health arena, but it's obviously more complicated than that. So tell me a little bit about SilverCloud.
Yeah, so SilverCloud is a digital mental health platform, so designed to enable healthcare organizations to deliver better access to healthcare for their cohort, the patients they deliver care for. So increasing access, scale, lowering costs, but primarily improving outcomes of care delivery. We spun out from well over a decade of research into the area, and that research was how can we take what we have, what can we take the industry knowledge there, improve on it in terms of engagement and clinical outcomes, and deliver it. And we spun from that research in 2012, and here we are today. I think we've 244 healthcare organizations across Europe and the US using it, and they be payers, providers, pharma, large self-insured, large corporate organizations as well.
I understand you got your beginning with the NHS, is that right?
Yeah, we did. We very early customer for us was the NHS. We did have some other customers as well in Ireland, which was a national charity for depression called Aware. But in terms of sort of large sort of cohort, large sort of break, yeah, absolutely NHS would have been our first one. So we entered that market and really worked and partnered with an NHS service called Berkshire NHS Foundation Trust just outside of London. Where we sort of helped to develop some of our programs across the kind of mental health spectrum with them, and then we began to sort of roll it out across the UK, and today we'd have 74% of the entire NHS using the platform across the mental health services.
I mean, that's fantastic uptake. And you are one of the more impressive digital therapeutics companies that are out there, I think, these days, because you've shown a lot of market traction. I think part of that has to do with the clinical validation that you guys have gone through. Talk to me a little bit about that, because I recall reading that you guys are able to show efficacy that's on par with face-to-face therapy. Is that right?
Yeah, interestingly enough, and even when it's taken outside of our control, if you will, and you look at NHS England data and how they will publish and show that on average, SilverCloud is achieving anywhere between 10 and 15% greater levels of recovery. Sorry, I should correct that. The services, the NHS services who are using the platform are able to leverage the technology to achieve 10, 15% greater level of recovery than they would with traditional group therapy, bibliotherapy, or low-intensity CBT. And for us, our North Star is outcomes. That's what we focus on, and we've really doubled down on that in every way, shape, or form. So we delivered, since 2012, we delivered about 300,000 end users or patients, about 100,000 in the last year alone, 1.5 million therapy hours, 5 million clinical interactions. So yeah, we're really proud of that, and in all our offices on the wall we'll have a sort of stat a ticker in terms of the number of users, and that's kind of our big thing. You know, one of my colleagues, I can't remember the number, but she's a co-founder with me, Karen, and our chief product officer. Her goal is 368,000 some odds, which is the population of Iceland, because she wants to say that we've helped a full country. You know, and then we've other. My goal is obviously 1 million. It's much simpler, it's much rounder, but yeah.
I love that. I mean, you're on pace to get there, and I think, kudos to you for, deploying your service at a time where it's really so needed. I mean, in the face of a global mental health crisis, where access to, this type of therapy is limited in a lot of places. So, absolutely needed, perfect timing. Tell me a little bit about your business. Are you guys getting reimbursed for your services on par with what a face-to-face office visit would get reimbursed? I'm curious about how that works.
It's always a challenge to get reimbursed to the level of what was there before, particularly when you come in and say, look at all the cost savings we will help and we will reduce. The reimbursement will always be a shade of what was there before. But yeah, in certain circumstances we are using sort of existing CPT codes like the collaborative care model in the US and other types of models. But what we are seeing, which is very interesting, is working with the health system, the provider, working with them to then actually come together, us, the provider, and then we both go to the payer and get an exception code in terms of reimbursement. So there's kind of two strategies. There's the individual strategy of tackling those unique sort of payers one by one, and then there's also then the sort of larger working with the American Medical Association and others to be able to tackle the challenges around sort of more wide reimbursement for this. So in the US, for example, what we deliver is asynchronous delivery rather than the sort of more traditional synchronous one-to-one live coaching that you would think of. The reason we do that is for helping around scale, have a more clearly defined clinical boundary, all those kind of things. But that's reimbursed in the state of Alaska and the state of Hawaii, but it's not reimbursed in the other 48 states. It will in short order, but it's just kind of interesting. You know, even within countries, you will have nuances as well.
Of course, because healthcare, it's just so easy to navigate.
Yeah.
I want to transition and talk about the business a little bit. So SilverCloud Health, you guys have been around for a while. Last funding round led by B Capital, and that was one of the co-founders of Facebook was in that. That's his fund. Tell me a little bit about that, and then where are you guys at now?
Yeah, so we were very lucky. The previous round, which was our Series A, was led by B Capital Group, which is a little over $8 million raise. We are finalizing now a further raise, which will see us essentially double the company in the next 6 months in terms of size and scale. So we're very, very excited with some of the partners that we have, and it'll be very much a strategic round in the proper sense of it, because we believe getting into collaborations, into partnerships with as many health systems throughout the US will be key, particularly when the reimbursement switch flicks on as well.
All right, speaking of collaborations, big collaboration with Microsoft, looking at integrating AI into your platform in a different way. Tell me a little bit about that.
Yeah, a term that I've tried to, I wouldn't say I've coined it, but I've used an awful lot.
You can say you can coin it.
Yeah, the problem is people can fact check these things. But what we kind of refer to that as is being sort of safe AI, responsible machine learning. So what we've worked with Microsoft on for about 18 months now was essentially what we have is we've over 30 programs across our range on the platform, covering your resilience, life skills, stress management challenges, full interventional programs right the way across, depression, anxiety, phobia, fear, panic, and then into the chronic disease, looking at the comorbidities between, say, diabetes and mental health, cardiovascular disease and mental health, and so on. So we have a very rich data set, and we've also a huge data set in terms of clinical interactions to date. So what we've been able to work with Microsoft on is basically leveraging some of that information, those data sets, to try and deliver a more optimized, signposted path through the content to help somebody get better quicker and last longer in terms of the duration of effect. It's not a chatbot, it's nothing Machiavellian or anything like that, and that's where I sort of say that the safe or responsible AI is very transparent, very high degree of security and privacy in terms of integrity. And we chose Microsoft because they genuinely shared those values.
I think that's a great partner to be buddied up with in this. Ken, thank you so much for your time. It's a pleasure to hear about SilverCloud. Best of luck to you. We'll talk to you soon. Thank you. I'm Jessica DeMassa with WTF Health. Thanks for joining us.